Welcome back to Learn with Professor Janula. If you're a nursing student, this channel is just for you. Don't forget to subscribe and hit the bell icon. Today we're learning about postnatal assessment. So go ahead, subscribe, and let's get started. Okay, students, let's understand this in a very simple way. After a mother delivers a baby, we don't just leave her like that. We need to continuously check how she is doing. That is what we call postnatal assessment. It means we are carefully and systematically examining the mother after childbirth to see if her body is recovering properly. We look at her physical condition, like uterus, bleeding, and breast changes, her psychological state, like how she is feeling mentally, and also her emotional condition, like bonding with the baby. At the same time, we are trying to identify any complications early, such as infection or excessive bleeding, and make sure she is having a normal recovery during the postpartum period. So in short, it's all about ensuring the mother is safe, healthy, and recovering well after delivery. Now let's talk about the purpose of postnatal assessment. So, why do we actually do this assessment after delivery? First of all, we want to check how the mother is doing physically and mentally. After childbirth, the body goes through many changes, and even emotionally, she might feel stressed or overwhelmed. So we need to assess both aspects. Next, a very important reason is to detect complications early, like excessive bleeding, infection, or any abnormal condition. If we identify these problems early, we can manage them quickly and prevent serious issues. And finally, the overall goal is to promote recovery and well-being of the mother. We want to make sure she is healing properly, comfortable, and able to take care of herself and her baby. So in short, postnatal assessment helps us monitor, detect, and support the mother during her recovery period. Now let's look at the articles required for postnatal assessment. Before we start examining the mother, we need to make sure all our equipment is ready. So first, we take a BP apparatus to check blood pressure and a thermometer to monitor temperature, because these help us detect early signs of complications. We also use a stethoscope to assess pulse and other body sounds. A measuring tape is important to check fundal height and uterine involution. For maintaining hygiene and safety, we must wear gloves. A perineal pad is needed to assess lochia and bleeding. We also keep a torchlight to clearly visualize the perineal area if needed. And finally, a record sheet is very important to document all our findings properly. So basically, students, these articles help us perform the assessment accurately, safely, and systematically. Before we start the examination, we need to properly prepare the mother, and this step is very important. First, we should explain the procedure clearly to the mother and take her consent. This helps reduce anxiety and builds trust. Then we must provide privacy, because postnatal examination involves personal areas and the mother should feel comfortable and respected. Next, ask the mother to empty her bladder, since a full bladder can affect uterine assessment. After that, we position her in a supine position, with the head slightly elevated, so she is relaxed and we can examine properly. And finally, as nurses, we must perform hand hygiene and wear gloves to maintain infection control. So remember, students, good preparation ensures the procedure is safe, respectful, and accurate. Now, we are starting the actual procedure, and the first step is the initial or general assessment. So before going into detailed examination, we first observe the mother overall. We check her appearance, hygiene, and level of consciousness, like whether she looks tired, pale, clean, alert, or drowsy. Then we move on to the most important part, which is assessing the vital signs. That includes temperature, pulse, respiration, and blood pressure. These give us a quick idea about her condition. Now, don't just record the values. Always interpret them. For example, if the mother has fever, it may indicate an infection. If you notice tachycardia, increased pulse rate, it could be a sign of hemorrhage or dehydration. So you should be alert. So remember, students, this initial assessment helps us quickly identify if something is wrong before proceeding further. Now we move to the first component of bubble he, which is B, breasts. So here we start by inspecting the breasts. Look at the size and symmetry. Both breasts should appear similar. Then check for engorgement, which means the breasts are overly full and tight, and also observe for any prominent veins. After that, focus on the nipples. See whether they are normal or if there are any problems like cracks or inversion, which can affect breastfeeding. Next, we move to palpation. Gently feel the breasts to check for tenderness or warmth, because these can indicate infection. Then we check for milk secretion, ensuring that lactation has started properly. Also, always look for signs of mastitis, like redness, pain, and swelling. So remember, students, this step is very important because it helps us ensure successful breastfeeding and early detection of breast complications. Now we move to the next step, which is uterus, and this is a very important part of postnatal assessment. Here, we palpate the fundus of the uterus. While palpating, we need to check 3 things: height, position, and consistency. So first, feel the height of the fundus, because it should gradually decrease every day after delivery. Then check the position. Normally, it should be in the midline. If it is deviated, it may indicate a full bladder. Next, assess the consistency. The uterus should feel firm. Now remember this clearly. If the uterus is firm and midline and descending daily, it is normal. But if you feel a boggy, soft uterus, that is abnormal and can indicate postpartum hemorrhage, which is an emergency. So students, always assess the uterus carefully because it gives us a direct idea about the mother's recovery and risk of complications. Now, we move to the next step, which is B, bladder. This is also very important in postnatal assessment. First, we ask the mother about her urination, whether she has any difficulty in passing urine or any changes in frequency. Many mothers may feel discomfort or hesitation after delivery, so we need to assess this properly. Next, we assess for bladder distension. A full bladder can cause problems, so we gently check if the bladder is distended. Now remember this important point. If the bladder is full, it can push or displace the uterus from the midline, which can interfere with proper uterine contraction and even increase the risk of complications like hemorrhage. So students, always make sure the bladder is empty because it plays a key role in proper uterine involution and recovery. Now we move to the next step, which is B, bowel. In this step, we mainly ask the mother about her bowel habits. So first, ask whether she is experiencing constipation, because this is very common after delivery. Then ask about stool passage, whether she has passed stool normally or not. Now remember, many mothers may hesitate or delay passing stool due to pain, fear of stitches, or discomfort, especially if they had an episiotomy. That's why constipation is a common postpartum issue. So students, always assess bowel function, and also educate the mother about proper diet, hydration, and early ambulation to prevent constipation. All right, students, now we move to L, lochia, which is very important in postnatal assessment. Lochia refers to the vaginal discharge after delivery, and we need to assess it carefully. So first, we check the color, amount, and odor. These 3 things give us a clear idea about whether the mother is recovering normally. Now, lochia has different types or stages. In the beginning, it is lochia rubra, which is red in color. Then it changes to lochia serosa, which is pinkish. Finally, it becomes lochia alba, which is whitish. This progression is normal and shows proper healing. But students, always remember, if you notice a foul smell or heavy bleeding, it is not normal and should be reported immediately, as it may indicate infection or hemorrhage. So in simple terms, lochia helps us understand how well the uterus is healing after delivery. All right, students. Now we come to E, episiotomy, perineum, which is a very sensitive but important part of the assessment. Here we examine the perineal area, especially if the mother has an episiotomy or tear. We use something called the Rita scale to assess healing. That means we look for redness, edema, swelling, ecchymosis, bruising, discharge, and approximation of the wound edges. So basically, we are checking whether the wound is healing properly or if there are any signs of infection. Along with that, we also ask the mother about pain in that area and observe how well the wound is healing. Remember, students, this step should always be done gently and with privacy, because the mother may feel discomfort or embarrassment. Proper assessment helps us prevent infection and promote faster healing. All right, students, now we move to H, home and sign extremities. In this step, we are mainly assessing the legs of the mother to check for any complications. So first, we look for calf pain, then check for redness and edema, swelling in the legs. These signs are very important and should not be ignored. Now, why are we checking this? Because these symptoms may indicate a serious condition called deep vein thrombosis, DVT, which is the formation of a blood clot in the deep veins, usually in the legs. So students, if the mother complains of pain in the calf, or if you notice swelling and redness, you should be alert and report it immediately. Early detection is very important to prevent complications. Now we come to the last step, which is E, emotional status. And this is just as important as physical assessment. After delivery, a mother goes through many emotional changes, so we need to assess her mood, whether she is happy, anxious, or withdrawn. Then observe the mother-baby bonding, like how she interacts with and cares for her baby. We also need to watch for any signs of depression, such as sadness, lack of interest, or irritability. Now, students, remember there are two common conditions: postpartum blues, which is mild and temporary, and postpartum depression, which is more serious and needs attention. So always assess the emotional state carefully, because a healthy mother is not just physically well, but also mentally and emotionally stable. Here's a quick memory tip to help you remember the entire postnatal assessment easily. We use the word bubble hay to remember the correct order of examination, so think of it like a shortcut. B stands for breast, U for uterus, B for bladder, B for bowel, L for lochia, E for episiotomy, H for home and sign, and E for emotional status. So whenever you are doing your assessment, or even writing in exams, just recall bubble hay, and you won't miss any step. It helps you stay systematic, organized, and confident during your procedure. Now, finally, we come to aftercare, which is the last step of the procedure. After completing the examination, first make sure the mother is comfortable, adjust her position, cover her properly, and ensure she feels relaxed. Then we should remove gloves and perform hand hygiene, because infection control is always important. Next comes a very important role of the nurse: health education. We should educate the mother about breastfeeding, proper hygiene, and nutrition to help in recovery. Also, we must explain the danger signs, like heavy bleeding, fever, or severe pain, so she knows when to seek help. So students, aftercare is not just finishing the procedure. It's about ensuring comfort, safety, and guiding the mother for proper recovery at home. All right, students. The final step is documentation, and this is very important in nursing practice. After completing the entire assessment, we must record all our findings clearly and accurately. This includes the vital signs, because they give an overall idea of the mother's condition. Then we document the fundal height and consistency to monitor uterine involution. Next, we record details about lochia, like its color, amount, and odor. We also note the condition of the breasts and perineum, including any signs of infection or healing status. And finally, don't forget to document the emotional status of the mother. So students, always remember, if it is not documented, it is not done. Proper documentation ensures continuity of care and helps in early identification of any complications. All right, students, let's wrap up with the conclusion. So, postnatal assessment is a very important part of maternal care, because it helps us ensure that the mother is recovering safely after childbirth. By following a systematic approach like bubble hay, we can assess each area properly without missing anything. This helps us identify complications early, such as hemorrhage, infection, or thrombosis, and take timely action. So in simple terms, students, a good postnatal assessment means better care, early detection, and a safe recovery for the mother. That brings us to the end of today's session on postnatal assessment. I hope you found this video informative and helpful. Thank you so much for watching, and don't forget to like, comment, share, and subscribe for more nursing and health-related content. See you in the next video.